So let's start with this to give a definition about gastroparesis. It literally means paralysis of the stomach. That means that the stomach is not working properly and it's not able to empty itself normally and to transit the food from the stomach to the bowel. So there are different causes for gastroparesis. The most common one is diabetes, uncontrolled diabetes, either type 1 or type 2. It is believed that high blood sugar will damage the nerves of the stomach and by consequence the activity of the muscles of the stomach, so the stomach is not working properly anymore. There are other medications also that can cause gastroparesis, especially antidepressants, especially some medications, painkillers, opioid like morphine. There are also some viral infections that can cause temporary gastroparesis and other diseases less common. For example, Parkinson's disease that affects the nerves and then can cause also gastroparesis, and another systemic and rare disease like scleroderma that will affect the skin, but also internal organs like the stomach. Well, if a patient is describing symptoms suggestive of gastroparesis, that means we are suspecting a disease in this patient. This is not a normal person anymore. What are the most common symptoms of gastroparesis? It's mainly nausea, vomiting, especially of undigested food. Some patients with gastroparesis may report symptoms of reflux, heartburn, especially after eating. There can be some pain in the stomach. There can be also bloating, feeling uncomfortable. Some patients in the long run can lose weight because of nutritional deficiencies, and the quality of life is generally poor in patients with gastroparesis. Well, if gastroparesis is associated with pain, the pain will be usually at the level of the stomach, so in the upper part of the abdomen. So if you suspect having gastroparesis, of course, you need to check with your doctor. So your doctor will go through your personal medical history, search for a history of diabetes mainly, will review your symptoms, run a physical examination, and then ask for tests. So there are different tests to diagnose gastroparesis. There is something that we call the barium test. So the patient will be given barium. This is a radio-opaque contrast that the patient will swallow, and we will see this liquid, how it goes through the stomach and the bowel. There is another more specific test, that is the gastric emptying scan. So here we use a meal that we give to the patient, usually it's eggs, with a very small amount of radioactive substance. So the patient will eat this meal and we will take a scan after 2 and then 4 hours. And here we talk about gastroparesis if more than 10% of this meal is still in the stomach at the 4th hour after ingestion of the meal. There is also a pill, a capsule, a wireless capsule that we can give to the patient orally. This capsule is connected to an external device, and this capsule will give an estimation of the time it took to pass from the stomach to the rest of the digestive system. There is no specific blood test for gastroparesis, but definitely when we suspect gastroparesis, we ask for blood tests mainly to rule out diabetes or to see if the diabetes is well controlled in this patient. Endoscopy is not used to diagnose gastroparesis, but it's usually performed in case of gastroparesis to look for consequences such as reflux, inflammation of the esophagus, but also of the stomach because of the food staying there for a longer time. And we do also endoscopy to rule out other causes of symptoms suggestive of gastroparesis and vomiting if there is any obstruction in the stomach. Well, here we are talking about two distinct clinical health conditions, but they are overlapping. Patients with gastroparesis, as said previously, they will present with symptoms of heartburn, but not all the patients with heartburn have gastroparesis. So it can be misleading, and gastroparesis sometimes is misdiagnosed, so it's better to check with your doctor if you have any doubt you may have gastroparesis. So gastroparesis, if left untreated, can have serious consequences. First, this recurrent and repeated vomiting can cause dehydration. It can cause a tear in the lower esophagus and bleeding. Also, there can be a weight loss on the long run because of nutritional deficiencies. And also, gastroparesis in patients with diabetes can cause uncontrolled and difficult to control diabetes. So here, I believe the question is about idiopathic gastroparesis. I need to explain what it means. In some cases, we have patients with gastroparesis, but we cannot find a clear cause. We do everything, we cannot find an explanation. Exercise, so far there is no direct link. It was not demonstrated by studies, but definitely exercise in all cases helps, especially if there is some overweight or obesity associated to this gastroparesis. Weight loss will help, definitely. H. pylori, here we are talking about Helicobacter pylori. This is a bacterial infection of the stomach. Actually, it has nothing to do with gastroparesis, but if ever there is gastroparesis plus this bacteria in the stomach, it may make the symptoms worse. The management of Helicobacter pylori infection consists of antibiotics and a treatment also with acid suppressants. Weight gain, no, actually it's the opposite. On the long run, gastroparesis, because of the slow transit of food to the bowel, will cause weight loss. Well, in case of gastroparesis, we always start with the conservative management, medical and dietary changes. So for patients with diabetes, if the diabetes is not controlled, we insist that the patient reviews with his endocrinologist, his internal medicine doctor to control his diabetes the best way possible. This will improve a lot the symptoms of gastroparesis. There are some medications we can give. There are medications that we call antiemetics, like metoclopramide, domperidone. This medication will induce contractions of the muscle of the stomach, and it will help emptying the content of the stomach. We can give also erythromycin. This is a type of antibiotic, but it helps also inducing contraction in the stomach, but we cannot use it for a long time because of risk of resistance to this antibiotic. And we ask also the patient for some dietary changes that maybe we can talk about later on. In gastroparesis, it's better to avoid anything that can slow the digestion. And here we are talking mainly about fat. So it needs to be a low-fat diet. We talk about also items that are difficult to digest, especially high-fiber elements, like, for example, again, apples, we need to remove the skin. Oranges can be hard to tolerate for patients with gastroparesis, broccoli, for example. So the surgery is the really last resort in case of gastroparesis. If despite all dietary changes, medications, control of diabetes, and the patient is still symptomatic, here we need to talk about surgery. There is a relatively new surgical option here, is what we call gastric electric stimulation. Here, a gastric stimulator or pacemaker is implanted under the skin of the abdomen and is connected to the stomach through electrodes, and it will send impulses, small, mild electric impulses to the stomach to generate contractions and help with gastroparesis. In severe cases also of gastroparesis, the surgeon can advise for a gastric bypass. That means that the stomach will be cut, only a small pouch will be created and connected directly to the bowel. Yes, nowadays there are a lot of new interventions, and they are all based on endoscopy. So with endoscopy, we can treat gastroparesis. There is a new technique called GPOM. This is for gastric peroral endoscopic myotomy. What it means or how it's done, so we insert an endoscope inside the stomach, and through this endoscope, a cut is made at the level of the pylorus. The pylorus is a valve between the stomach and the bowel. So by cutting, we relax the valve and the food can go easily from the stomach to the bowel. There is another technique that can be done also by endoscopy, is injecting Botox or botulinum toxin in this pylorus, this valve, to relax it. And here the transit is easier and smoother from the stomach to the bowel.